Well, of course, Dr. Bharat Pankhania is a senior clinical lecturer at the University of Exeter Medical School. Joins me now from via Skype from Bath in England. Good to have you with us on the programme. I mean, as you've heard from our correspondent Jonah, 1,200 doctors really appealing to the Lancet to make their voices heard, that they think the government need to change course. They need to rethink their strategy before Monday. Are you in agreement with them?
I am very much so, and I'm very happy to say openly that I was one of the signatories to that letter in the Lancet. And in that letter, we explain that we haven't really immunized the majority of our population. Well, we have, but we've still got 48% to still immunize. And to allow an infection to run its course equals lots of consequences: hospitalizations, deaths, and long COVID.
OK, let's just talk about the situation as you know it in terms of the hospitals and the medical care. Have the hospitals and their staff been able to recover from the last wave in terms of getting their numbers back up to a level where they can cope with anyone who is infected or anyone who needs care in hospital?
Well, of course not, because they are extremely tired from having 18 months of serious overwork under a lot of pressure and stress. So whilst the hospital wards are just about adequately staffed, it is teetering on it can't be done, because there is that human factor of burnout, tiredness, and absolutely worn out from relentless hard work over 18 months.
Now, one of the other issues is that the simplest of precautions is being withdrawn, and that's the wearing of a mask, with the government thinking and saying that the British public have the good sense to make a decision for themselves. Yet public transport, pubs, clubs, restaurants, all saying they can't enforce, they will find it difficult to enforce that. Is that a measure that the government can take a U-turn on?
They should take a U-turn on, because it is so simple and straightforward, and it is a minor inconvenience and a lot of benefit if good quality masks are worn properly and enforced by government mandate rather than individual organizations or businesses mandating it. It is really a simple thing, and it is a shame that it was just dropped to gain popularity and be popular and appease Prime Minister Johnson's backbenchers who want all restrictions to be removed. The science would tell you otherwise. Wear your mask, wear it properly, and it will save lives.
Not just for the British viewers that are watching Al Jazeera now, but for our international global audience. Please tell us, why do we have to wear a mask? Well,
the SARS-CoV-2 virus is predominantly spread by the aerosol route. And what that means is it is in the air, and it spreads to further distances than 2 meters that everybody talks about. So if you were to wear a mask, it reduces the throwing out of infectious virus particles. And if somebody is throwing them out in your direction, a well-fitting closed mask prevents a lot of those virus particles from hitting your nose and mouth and infecting you. So the mask, worn properly, a good quality one, protects the person wearing it and protects other people as well.
It's always good to remind everybody what it's all about at the end of the day. It's the small things that matter. Dr. Bharat Pankhania, thanks so much for joining us from Exeter Medical School in the UK.